Okay, so it's grocery day in my house, and because of he who shall not be named, I decided to do an impromptu video and show you my routine to get ready to go grocery shopping for my family of 7. I just want to take a moment and make a cheap plug and say my husband has this thing called a job, and today is his payday. So today is the day that we go grocery shopping. I have private insurance, not public insurance. And it is not food stamp day, it's pay day. Okay? Just to get rid of some stereotypes. Um, I didn't want to totally freak you guys out, so I've already done part of my routine this morning. I put on my sunscreen moisturizer. People of color, can we please stop the stigma that we cannot get skin cancer? Part of my problem is sun sensitivity. Even though I have melanin in my skin, I am still sensitive to the sun, so I have to wear sunscreen, and a lot more people should. Also, I've already put on my eyeliner because I don't want to freak anybody out by seeing me without my eyeliner. And my hair is straight this week, yes. But it won't be next week. I'm just in the first week of the process on my hair that I have to do in order to make my hair manageable. So it's going to be straight this week. Gotta have your lip balm because you have to look as gorgeous as possible. I got an allergy test a couple weeks ago, and I am definitely allergic to grass, trees, weeds, mold, and dust. But I have really severe asthma, which is exacerbated by my allergies. And so I went and did an allergy test because I was having trouble breathing. The doctor told me that the proof of the test would go away in a couple hours. Instead, 4 days later, I had to get a steroid injection. And even after the steroid injection, I was still red, and I have scars, permanent scars, right there from the allergy test. The doctor kept saying something. He kept saying I'm what they call dermographic. And what that means, it literally means right on skin. And so the test actually wrote on my skin. These are just some of my scars because, of course, it's hard to show on a video different skin. This one is really gross, and that one's really gross. Anyway, dermographia is a disease in itself, and my doctor kept saying the word like it was no big deal, but it is. And I told a friend of mine, I said, imagine this is what's happening to my lungs every day when I go out in public and I'm around grass and trees and weeds, or when I'm at home and I'm exposed to regular everyday common molds or dust. This is what's happening to my insides. It's really debilitating, and people don't think of allergies and asthma as debilitating, but they can be. Okay, so because of my asthma and my allergies, before I can do anything in the morning, I now have to take this inhaler. This is a new one to the market. Prior to this inhaler, I was not able to breathe. And I have to give myself a nasal spray. And they tried, of course, I tried over the counter and I tried the first level. They didn't work for me. For about 10 years, I didn't know what it felt like to actually be able to breathe through my nostrils. So, and I have to do this morning and night. And I also have to use my lemon water to take a ridiculous amount of supplements. The lemon water is because I have not been able to get doctors to heal my stomach disorders. I have severe digestion disorders. And even though he who is not to be named can get proper medication so that he can fix his erectile dysfunction problem that I'm sure he has, I can't get proper medications so that I can eat foods that people eat every day, or not have acid reflux problems, or not have disturbing stomach aches. So I use my lemon water to take my supplements that are already parceled out for the days of the week. But I just want to give you a graphic of what it is I take every day. And I take vitamin D because I'm unable to spend a significant amount of time in the sun due to my photophobia. I also take a daily multivitamin just because it's the healthy thing to do, and hopefully that'll make up for some of the foods that I'm unable to eat. And I take skin, hair, and nails to make up for the fact that most people with different pain disorders have a significant hair loss. I have a lot of hair loss. I have another video to show you guys, but it's short up here in the front, and it's shorter on this side than it is on this side because of hair loss. So I have to take hair supplements every day. I also take keratin to try to help with my hair loss because that is something that really hurts women. We're taught that women are supposed to have beautiful hair. And I also take turmeric, which is supposed to help with my pain on a daily basis, because even though he who cannot be named can depend on getting his erectile dysfunction medication, we are not able to get pain medication on a daily basis without being considered drug addicts. Also, I take magnesium for several of my disorders that doctors refuse to treat medically, so I have to take supplements. So I'm going to take a moment and take my supplements. And this is what sparked this whole thing for me. I am about to take pain medication just to go grocery shopping. If you can see the date on this, I have had the same 30 pain pills for the past 7 months. Okay. And I only use them in grave circumstances. Today, I can barely move, but my family of 7 is depending on me to go grocery shopping so that we have food in the house to eat. So I'm about to do something that is going to cause me extreme pain. People might stare at me because, yes, I am physically able to walk, but as of this moment, my calves are extremely tight. I feel like I played the Super Bowl on Sunday. My whole body is achy. I'm starting to blink. I can see myself because, of course, I have the lights. I have to remember my sunglasses when I go out. So yeah, that's what it looks like to be a chunky. You're right.